Hi there, my name's Michael Stansel. I'm presenting the anxiety disorder. I personally chose this because before I started dating my current wife, I didn't actually understand this disorder. And we'll go back to my wife later. Uh, but I believe that people need to understand the disorder a little bit better and have a better understanding. And me personally, just having a firsthand experience with it through my current relationship, I think I've been able to elaborate a little bit more on personal experiences and whatnot. And I think there's a little bit of misconception of like what it means and how people think it's like a macho thing to not have it, and it's a not macho thing to, you know, masculine thing. Whatever. We'll get into that later. Anyways, going on. Oops. There we go. So, looking at the timeline of anxiety, it started in 1896 with Dr. Miller. He discovered 30 of his patients displaying weakness or even neuro exhaustion. And what he meant by neuro exhaustion is almost like a form of retardation. And he didn't quite understand it. He just classified these people as the brain didn't really work at full capacity. And he noticed this with this 30 patients that he was doing a study on, and he really couldn't pinpoint exactly what it meant. Further down the road, a lot further down the road, actually, now to 1952, anxiety then got classified as a reaction to unconscious impulses and other factors. So, that being said, I mean, if you really interpret that, anyone could really have those kind of impulses or kind of reactions, but it kind of goes furthermore into the definition of what it means and what the fear aspect of it is. Uh, but actually, 30 years later, they diagnosed anxiety disorder. In order to be it needed to be diagnosed with anxiety disorder, which I'm having a little bit right now. Um, you need to be affected by it with your everyday life. So that could be a simple thing like driving to the grocery store or taking the trash out because you just feel like this impending doom or this kind of uncomfortable feeling in general. It's I'll get more into the feeling of anxiety, and I don't want to talk too much about it because I mean, I'm going to talk about anxiety, but a lot to do with the interview will clear a lot more things up. So, what does it mean? By definition, anxiety is an emotion characterized by an unpleasant state of inner turmoil, often accompanied by nervous behaviors such as pacing back and forth. Um, it could be, thinking about asking this girl out to prom, thinking she's going to say no right away. It also includes subjectively unpleasant feelings of dread over anticipated events. And I know a lot of people are thinking just by that definition, well, anyone could have anxiety, and that's true. Anyone could have anxiety. I have anxiety just recording this right now. But it goes further than that. But we'll also get into that more later in the next slide. So I put up a few images of just anxiety inducing because, I mean, cookies and orange juice, that's just wrong. There's no argument to it. Some guy messing around on a pull-up bar over some cliff. There's thrill seekers out there. I get it. Maybe some of you look at that and say, yeah, that's me. Cool. That's not me. I enjoy inside and whatnot. Anyways, those are some images of some anxiety inducing kind of stuff. So, what symptoms anxiety has? So, you could feel nervous, restless, tense, all this stuff. Once again, a lot of you are thinking, well, I feel that. What's the difference between someone that's diagnosed and has anxiety? Well, once again, just wait. I will get back to that. But we got to cover all of our bases, then we'll get to the home run. At Ickety be. Ugh. Is that English? The average age of onset is actually 7 years old. And when you get older, it doesn't worsen. It actually, you're more likely to suffer from anxiety. So, that being said, if you feel like you've gone through your day, you've gone through life, and everything's been dandy, and anxiety is not a thing, well, you're more likely to suffer from it because all of a sudden you feel alone, stuff like that. Family members don't visit you as often, not to get depressing or anything, but stuff like that happens. So that's why I say, and the research says that people are more likely to suffer from anxiety because it's also a form of depression. So, what is the psychology of it? Physiology, excuse me. So scientists' studies have shown that people with anxiety have more activity than normal people in their limbic system. So their limbic system, people don't know, is basically your fear center of the brain, which the second bullet states, and almost everything's heightened. So if you're feeling dread or, anxious about going from Ventura County driving to LA, I personally don't like that. I know a lot of people don't. Feel like if I miss a wrong exit, then I'm completely lost. Maybe someone with anxiety, that's 10 times worse. Or it's very much heightened. And going on to the third point, the stronger sensation of fear than an average person. So it's almost like everything as far as like fear and being anxious is really heightened with someone that has anxiety. So what treatments do we have? There's therapy. There's SSRIs, which is selective serotonin reuptake inhibitors. So explaining how that works in our system and kind of I guess you'd say like the plumbing and everything. So the way serotonin works is it's a happy pill or happy drug. And you think of it, it goes in your system and does its job and then it leaves. So people with anxiety, they need that serotonin to kind of reuptake. So what this drug does is it holds it in place and it recycles it. So that person with anxiety actually has a kind of a calming resting place as far as like just not being in that anxious state and kind of finding that happy medium. That's more of what like anxiety medication does. Some people argue that could be an addictive measure, but the studies have been shown that it's really not an addictive kind of drug, but it definitely helps people with anxiety as far as getting their mental state and helping them function in a normal day-to-day. So, generalized anxiety. This is the one I've been hinting at the whole time. Generalized anxiety. Stress, panic, overwhelm, study last minute, talking to the opposite sex. Anyone could have anxiety from that. Diagnosed anxiety, it's no logical reason. Really can't explain it. The person with anxiety, I can't explain why I'm feeling like this, but I feel like this. I feel like I can't breathe. Overwhelmed, impending doom. Panic attacks, outside doesn't feel safe. These are just some of the things that maybe a person with diagnosed anxiety would say. So, that being said, instead of just talking about someone having anxiety and just talking about generalized points, I'm actually going to interview my wife, who she was happened to have the day off, and yeah, so I'm going to ask her a few questions, and I'll scoot back so we can get her in the frame too. Okay, so this is my lovely wife, Brooke.
Hello.
And this is our lovely garage, by the way, which I'm sure just sometimes that's how you have to do stuff. Anyways, so this question kind of introduces her, and yeah, let's just get on to it. So, how long have you had this condition for, And what is it like to live with it?
Well, my mom always jokes and says that I was born stressed and anxious. So when I was young, I really had a lot of anxious tendencies. Like, I didn't want. Um, I would say that the anxiety became more debilitating when I entered middle school, so around sixth or seventh grade. Um, what was the second question?
The second one was, what is it like to live with it?
Um, I mean, it's kind of a hard question because I don't know what it's like to live without it. Um, but basically, when I was younger, I would often, every day before school, I would throw up and I'd be freaked out. And really, there wasn't any reason because, school was pretty much the same every day. But I was always worried about, not knowing what was going to happen in the day, which obviously you can't know what's going to happen every single day of your life. So that would cause me a lot of stress. It definitely makes things more difficult, or you have to figure out different ways to do things that might be easier for other people. So, for example, I really love to go to Disneyland, but for me, you know, when I was younger, I would always go on a ride first that had bushes by it in case I needed to throw up. And usually, once a day started, the anxiety would go away a little bit. Also, I really always had to have friends or family around me who knew what I was going through because I would feel very um, out of place if somebody didn't know, and I'd think, oh, they're going to think I'm weird or that something's wrong with me, etc.
Right. And I mean, like I was kind of saying earlier, you were kind of off to the side. Like
Mm-hmm.
someone with like generalized anxiety, it's like everyday things, but with a person like yourself who's diagnosed with the disorder, you said it word for word. You just don't know why, but it happens.
Well, and I think, for example, for example, if somebody had, a project they had to present to the class, everyone would be like, oh, I'm nervous about this. And yeah, it's kind of awkward. I don't like being in front of people. But for me, it would be, okay, I didn't sleep the night before because I was stressing about what would happen. I was thinking about how if I messed up, people were going to laugh at me, or, you know, um, even sometimes before my speech, I'd end up having to like run out of the room and throw up before my speech, even though it wasn't logical because I was good at actually doing presentations. So I get an A or B, and I would still be so worried. So when people would say that, I would have sympathy for them, but it is a whole different type of anxiety, basically.
So it's more than just like you said for the everyday person. For me, like doing this presentation,
Mm-hmm.
I'm stressing about just making sure the mic's picking me up okay and the camera's working. But for you, it'd be like 12 other things before even those two things.
Yeah, I think you just think of the worst thing that could happen.
Mm-hmm.
And usually you think the worst thing that could happen is I like die up in front of there, like things that just aren't logical, or I'm going to feel like I'm having a heart attack and not be able to talk or something like
Yeah.
that.
Okay. Um, Next question is what treatments have you had or considered having?
So I have taken, what was it,
SSID.
SSID
Yeah.
medications. Um, I, for a long time, did not want to take them. So I think I started taking them around 10th, maybe even 11th grade. Um, I tried to avoid taking them because I didn't want something altering my brain, I guess. But actually, when you have anxiety, you have a chemical imbalance. So you need those things. Sometimes some people need those things to help them just get to that regular level as everybody else is in their brain.
Mm-hmm.
So I have been on those for a long time. I still am. And then also, I have done a lot of therapy, which has helped. I haven't done any in a little while, but I think therapy can really help a lot of different people. So I would always suggest therapy and talking to somebody before going on medication, just to make sure, there can be other coping mechanisms. Like for myself, when I was younger, a big thing was throwing up. And so I would be in class and I'd be thinking about, okay, where's the trash can? Where's the exit? How can I get out of this classroom?
Right.
So then I wasn't able to be paying attention to what I was doing in class. So I had a therapist recommend carrying like a Vaughn's bag in my purse. So then I wouldn't have to think about the steps of figuring out what I was going to do. I'd just know, okay. And it was almost like a security blanket for me. So I think, doing those things with medication can really help.
Okay. Last question. How has your family supported you through this condition?
Um, I mean, I have a great family. I think sometimes it's hard for people to understand at first. When you're younger, they can just think, oh, she doesn't want to go to school, or, ask you, oh, well, why don't you want to go to school, thinking, oh, you're being bullied or something like that. And when you have anxiety and you can't explain it, it can be very frustrating, I think, for everybody involved. I think over the years, they just kind of got used to how I was. I mean, they always supported me going to therapy and getting on medication. But I know that it can be hard for other people around you. So sometimes having anxiety can feel like you're burdening your family and friends, which sometimes would make me not want to do certain things because I felt like, okay, I'm going to probably ruin everyone's day if I don't feel good and I need to like go back to the hotel or something like that. But luckily, my family, at least one of my family members would always go back with me or help me realize that I'm safe. And I've always felt very safe around my family. So being around them in general just made my anxiety less because I knew that they would have my back no matter what. Same with my husband. But it does take time. For example, like somebody like Michael who doesn't suffer from anxiety, you know, they kind of have to learn how to deal with it, deal with panic attacks, and just the fear of really the unknown, or the fear of, why are you freaking out? Like, we're just going to Vaughn's like we've done 100 times. So I think it's important to also just be able to talk to your family and friends about, what helps you, what doesn't, and all of that. So,
All right. Well, thank you for letting me interview you.
hmm
Um, I think I just want to wrap up and say that I felt like this was important to cover because at first, when I first started dating Brooke, I didn't understand it. I didn't really understand these feelings, and now I really understand how, they're real. And I really did think, okay, this girl's like a class actress, but it's 100% real, and it just took time. And a lot of people just need to take the time to learn about it and not assume that anxiety is something that just you can just get over it. Like, it's just in your head. It is in their head, 100%, but it's part of their plumbing and everything up there. Anyways, thank you for tuning in, and have a great night or day.
bye.